if I had known how difficult this business was going to be to build going into it, I probably I don't know if I wouldn't have built it, I would have thought a lot harder, right? I actually paused for 5 months building the company because I was afraid of the legal and compliance and regulatory challenges around it. And we brought in the best counsel in the country. It's Nate Lockman from Foley, and I felt comfortable there. But what I think we got lucky, and honestly, there's so much luck in this journey. One of my co-founders, he specializes in building, I would say, very complex software for really, I'd say, difficult businesses. And what we had to spend so much time doing was being part of the business ourselves on a daily basis, helping with the patients ourselves directly, and basically making sure that as we learn how to do something manually, and right there was something we would do 1,500 times manually, you then build the technology solution and then you got to test the hell out of it and then build the next manual thing. And I think that a lot of people, when they come into telehealth, they think, oh, I'm just going to go pull an EMR off the shelf. I'm going to use someone like True Pill to get my meds, and I'm going to paste it together via API. I'm just going to push patients through the experience and spend some money on Facebook. That's not healthcare. That's bullshit. I mean, I don't mean to say that like that. Like they're providing good, and they're helping patients. But the reality is that you're not creating anything that's differentiated, that's going to stand the test of time, and someone's going to come eat your lunch because you haven't done anything different that's difficult. And I'd say now going through it, when people tell us they're coming, they're going to build a testosterone company, I say, listen, God bless you. Go for it. Like you have no clue what you're signing up for. And I think it was really having founders and a team that is so mission driven that we were like, hell or high water, we're going to figure this thing out. I'll tell you, there was a time when we were selling a lot of testosterone during COVID. And our pharmacy came to us and they said, you broke us. And you're like, what do you mean we broke you? And they're like, well, we can't sell you any more testosterone because we've never had someone order so much this quickly. And we're like, why didn't you tell us that before? That's crazy. And they're like, well, we didn't know. And so here you are about to run out of testosterone. You've got like at this early point in time, 1,500 patients. You're like, well, shit, how do I solve this problem? And everyone just jumped in. They picked up the phones and we called 1,500 patients, apologized profusely, found another pharmacy, and then finally got the products to them. And I'd say the other really important thing is if you truly are dedicated to patient care, the single most important insight that we've realized is all you have to do is get your patients' medications on time every single month. Nothing else matters. I'll tell you, nothing else matters. And during COVID, and when you're scaling at a relatively rapid clip, it's really hard to do perfectly. And so, what I would say the other thing that we learned the hard way is you can't just have one supplier, can't just have one EMR, can't just have one blood testing lab. You've got to create redundancy in your business and you've got to figure out how to shift the redundancy relatively fast. And you've got to create a culture that actually is capable of doing that. And then I'd probably say, like, the other thing that I wish we had known going into this is that when you have a business that has multiple blood tests and requires them every 90 days, assume each of those transitory points are a funnel in themselves. And you need someone to babysit each one of those funnels and make sure they're helping patients get all the way through, because that's where you actually can lose the entire business. So that'd probably be the other really big learning that we got.